Scott County is asking the state for permission to continue its syringe exchange program for a second year. The exchange became the first of its kind in Indiana following the HIV outbreak in Scott County. Reporter Barbara Brozier joins us now with more. Barbara, what does the county have to do to keep that program going?
Well, Joe, this is uncharted territory since syringe exchanges have only been legal in Indiana for about a year now. Now, as part of the bill legislators passed to make that happen, counties must provide the State Department of Health with annual updates about their programs. That includes information about the number of people using the exchange and the number of needles passed out and turned back in. Scott County leaders want to continue their exchange because they say it's helping slow the spread of HIV. But much of the community remains divided over the program's effectiveness. When you drive through the neighborhood at the center of Indiana's HIV outbreak, there's something that jumps out at you. House after house, block after block, there are dozens of no trespassing signs posted in people's front yards. Some residents even have their driveways roped off.
I make my stand out here sometimes, run some off. The neighbors are trying to clean it up a bit.
We knocked on a lot of doors here, wanted to talk to people living in Austin about how things are going. More than 190 people in Scott County are living with HIV, an outbreak sparked by drug users sharing needles. We talked to several people who are unhappy with the needle exchange. They say they're still finding used needles in their yards and on public property. That's one of the reasons you see all of those no trespassing signs around here. Some think the exchange enables the users and contributes to the problem. But we also spoke to a couple of people who are hooked on the prescription painkiller Opana. They call the needle exchange a lifesaver, one that allows them to save their money for food, transportation, or health care. Austin, in many ways, is a town that remains divided over whether the needle exchange is doing more harm than good. And no one was willing to talk to us on camera about that, out of fear of becoming some sort of a target, except Michael Steele.
I don't feel that the needle exchange is exactly a good thing at all. I think that the state should check into having a rehabilitation center.
That's a sentiment many of his neighbors share. But Scott County's health department says you can't dispute the numbers. Governor Mike Pence declared a public health emergency last March, allowing the county to set up a temporary needle exchange program to help control the HIV outbreak. At the time, there were 79 cases of HIV. By May of last year, the number of cases reached 164, and the outbreak was slowing. Since then, health officials have diagnosed fewer than 30 new HIV cases.
The needle exchange is a vital piece of prevention. The most potent way to prevent the spread of HIV is to treat HIV. If the viral load is undetectable, you can't spread it. That patient has come out of that group of people that can spread HIV. But we know that there's still a large percentage that are not in treatment for whatever reason. And how do we prevent them from spreading HIV to others?
But at a recent meeting of the Scott County Commissioners, health officials said the community needs to look beyond prevention and think about the long-term implications of the outbreak. Treatment remains difficult for many of the people hooked on Opana. But there are more resources in Austin as a result of the outbreak. LifeSpring Health Systems now has an office across the hall from the county's needle exchange program.
We provide behavioral health treatment. So we've got everything from individual therapy to group therapy, as well as psychiatric services and case management services.
The state recently awarded LifeSpring a grant to help expand its detoxification services, which includes medically assisted treatment. But need doesn't always translate to demand. Many people here can't afford to go to an inpatient facility for treatment, which requires them to leave their homes, jobs, and their families for at least 30 days. And the wait to get into those facilities is worse than it was this time last year, when Scott County residents were bumped to the top of the list because of the outbreak.
At the height of the outbreak, we were for Scott County residents, we were looking at anywhere from 1 to 2 weeks. I think the average now is 5 to 6 weeks.
People who do get into those facilities often find themselves in a tough situation once they're released. There's no transitional housing in Austin, and the community lacks the social support many people need to stay clean.
That is the one thing that I wish was going better too. It's a slow process. Everything takes time. And it's, you know, you're like, we're at a year now, and that's still one of the things that we're still really lacking in. And there's things in place that are working to try to help us through that, but it's just such a slow process.
The pace is frustrating for many people in the community who see rehab is the only way to address the ongoing problems here.
Jail is not going to rehabilitate them. They won't get the drugs, but a lot of the times when they get out, they're worse than when they went in.
But IV drug use in Austin has been going on for years, and health officials say it will likely take just as long to correct the problem as it did to create it.
This wasn't something that was created in a very short time. It's not something that's going to be fixed in a really short time, and so what we're doing is taking piece by piece, step by step, trying to do what we can in our little niches, you know, trying to fill the void and gaps where we can.
On average, the Scott County Health Department hands out 20,000 needles per month. Participants are supposed to exchange dirty needles for clean ones, but the health department is handing out more needles than they're receiving in return. The cost of providing those needles is covered by grants.